Every second counts, but you may find yourself waiting a little bit longer than usual if you need an ambulance or if you need to see an ER doctor in Pinellas County. Wait times are going up. Fox 13's Dan Maddox is live in St. Pete. Hi there, Dan. I know we want to stress anybody having an emergency should still call 911 or go to the ER, but still this may be a bit troubling.
Yeah, and this is exactly what they feared. You know, things got so bad this afternoon, there weren't enough ambulances, and they had to load people into vehicles like the one you see behind me, rescue units. This is what we're talking about today. You can see these are all medical calls, except two of them. These are all medical calls. The director of EMS and fire for the county says in July, under normal conditions, about 98% of all 911 patients arrive at hospitals by EMS within 15 minutes. But the Delta variant, the rapid transmission through the unvaccinated community, is increasing demand for emergency services. The county administrator, Barry Burton, says right now only about 50 to 60% are getting to the ER within 15 minutes. And for 10% of the population and 10% of the patients, it's taking more than an hour.
Our ERs are overwhelmed right now. And that is both a issue of COVID and also staffing issues. With that, the ambulances are waiting longer, so they're being held at the hospital instead of a 15-minute turnaround to drop a patient off and put them in the care of the hospital. The hospital, it may be an hour.
So to help, we are told that Sunstar paramedics, the county ambulance service, and fire rescue departments, they've increased the number of ambulances on duty. And county EMS is also using, as I mentioned, their fire rescue units for patient transport during those peak periods. But they say until this wave is brought under control, they are going to continue to see the stress on the healthcare system. And Mark, they say the key to this is really increasing that vaccination rate. Back to you.
Dan Maddox live in Pinellas County for us. Dan, thanks.